Full disclosure, I know nothing about race cars. With that being said, imagine that you are a race car. You spend your life zipping around the track with your steering wheel providing direction, your wheels carrying you where you need to go, and your engine pumping the fluid that powers everything else. Every so often you take a pit stop. It's no big deal, you get a wheel changed or a scratch buffed out. But sometimes there are bigger issues. Sometimes your engine might fail, but that's still okay. We have mechanics who can take out that engine and replace it with a donated one. And a year later, 5 out of 6 race cars are back out on that track. But I'm not talking about race cars. I'm talking about heart transplants. Despite being a phenomenal life-saving procedure, almost 1 in 6 heart transplant recipients don't survive the first year post-op. This can be because of damage induced during the heart transplant process, or rejection experienced afterwards, or for a multitude of other currently unavoidable factors. My research aims to improve this process using microRNA. MicroRNA are small molecules which act as a form of gene expression regulation. They bind to their targets and inhibit them, and they've been linked to a number of cellular functions. Essentially, they're like the oil in a race car. They keep everything running and operating optimally, including in the engine. But just like your oil can spring a leak or require a filter, sometimes microRNA stop helping. They've also been linked to diseases, including heart failure and rejection after transplant. This is why microRNA could prove crucial to improving the heart transplant process. My research aims to characterize changes in microRNA expression before, during, and after heart transplant. In particular, I'm looking for changes which correlate with an increased patient survival and an improved quality of life. If you look at the yellow car on my slide, this car experiences engine failure and requires an engine transplant. We can take oil samples when it first starts to fail, immediately before transplant, and after when it's back on the track. It has a 5 out of 6 chance of ending up like the blue car, back on the track a year later. But its engine could fail again, like the red. If we repeat this experiment again and again and see the same results, this decreased expression shown in the graph correlating with a worse outcome for the race car, then we can intervene. We can use drugs to increase the expression of microRNA at those times and increase the chances of a successful race car outcome. This therapeutic intervention is the ultimate goal of my research, but before we can start changing the oil, we need to understand what's in it. Only then can we better prepare heart transplant patients and ensure that every pit stop lasts a lifetime.